Dysarthria. What is it, and how can SLPs help? Dys means disorder, and arthria means movement. Dysarthria is a motor speech disorder affecting how we move our bodies for speech. Dysarthria is caused by damage to cells found in the brain called neurons. These neurons help control the movement of our muscles. Damage to them affects our ability to move the mouth, tongue, make speech sounds, and use breath support. How do the motor neurons get damaged? Degenerative diseases, congenital diseases, traumatic injury, strokes affecting blood flow to the brain, and demyelination of neurons can lead to motor neuron damage.
As for the symptoms of dysarthria, one of the main symptoms would be muscle weakness or a lack in tone, which would then cause someone to not be able to move their lips, tongue, or jaw very well. Other symptoms include too slow or too fast rate of speech depending on the type of dysarthria, slurred or mumbled sounding speech, and poor breath support, which would impact phrase length and make it shorter. Dysarthria also affects reflexive, automatic, and voluntary movements, which would cause reduced reflexes or tremor-like movements. Dysarthria also causes changes in a person's voice, so loudness may be low or weak and may be produced as monotonous, which would sound robotic or choppy. Pitch would be low, monotonous. Quality would be weak, hoarse or harsh, strained or strangled, with some intermittent breathiness, or even possible nasal speech quality. As for articulation, consonants may be imprecise and distorted. Therefore, a person may have poor speech intelligibility.
How can SLPs help an individual with dysarthria gain communication skills? Clinicians will need to adjust their treatment tasks according to the requirements, abilities, type, and severity of dysarthria. The treatment can be surgical, such as a pharyngeal flap procedure, where a flap tissue from the pharynx is surgically attached to the velum to correct airflow. It could be prosthetic, such as a palatal lift, where a dental retainer with a rear extension helps push upward on the velum to help individuals with resonance problems, or behavioral, where an SLP can help the client reduce their rate of speech. SLPs may work with the individual on velar strengthening and non-speech exercises, vocal relaxation exercises such as humming while chewing, which relaxes oral muscles, or increasing their intelligibility. In addition to behavioral treatments, the SLPs can help the client with reducing their rate of speech, having a more open position mouth during speech, and increasing their loudness.